Matilda Arabella Evans, born 1872, died 1935. African-American physician. Matilda Arabella Evans was the first licensed African-American female medical doctor in South Carolina. She founded several hospitals and clinics, including the first free clinic in the state, where she treated both black and white patients. One of her hospitals, Taylor Lane, was the first black hospital in Columbia, South Carolina, and also served as a training school for nurses. Evans was especially concerned with the welfare of children, and she developed a program for providing medical examinations to students in public schools. Additionally, Evans founded the Negro Health Association of South Carolina. Evans was born on May 13, 1872, in Aiken County, South Carolina, to Anderson and Harriet Corley Evans. As a child, Evans attended the Schofield Normal and Industrial School, located in Aiken. The Schofield School was founded in 1868 by Martha Schofield, a Quaker from Philadelphia, under the patronage of the Pennsylvania Freedmen's Relief Association. The school was established to educate young African-American children and attracted students from every part of South Carolina. Martha Schofield became Evans' mentor, and she encouraged her to attend Oberlin College. In 1887, Evans enrolled in the college's preparatory department, and within 3 months she was awarded a scholarship for her tuition. To pay her living expenses, Evans worked as a waitress in Oberlin's dining hall during the school year, and during the summer she canned fruit. She left Oberlin in 1891, 3 months before her graduation, to pursue her goal of becoming a doctor, perhaps a medical missionary. Evans worked for several years as a teacher, first at the Haynes Institute in Augusta, Georgia, and then at the Schofield School. In 1893, again with Martha Schofield's encouragement, Evans enrolled in the Women's Medical College of Pennsylvania. Evans was given a scholarship by a wealthy Philadelphia philanthropist, Alfred Jones. The only African-American in her class, she graduated with her medical degree in 1897 and returned home to South Carolina. Evans settled in Columbia, South Carolina, where she opened a private medical and surgical practice which attracted patients of both races. It was immediately successful, and soon Evans had so many patients that she began to use her own home as a hospital. In 1901, Evans rented a building and founded the Taylor Lane Hospital and Training School for Nurses. This was the first black hospital in Columbia, a city whose population was half African American. Evans eventually had to give up her own practice to manage and work at Taylor Lane. When this hospital burned down, Evans founded St. Luke's Hospital in its place. In both hospitals, Evans played a critical role in the education of nurses and the clinical training of black doctors and surgeons. In addition to practicing medicine, managing a hospital, and teaching, Evans also worked to improve public health. After researching and observing public health clinics in several major cities, including Durham, North Carolina, Philadelphia, and New York City, she founded the Columbia Clinic Association. The association provided basic health maintenance education and medical services, including vaccinations, to the poor free of charge. Evans recruited doctors and other medical practitioners of both races, including specialists, to work in the association's clinics. Along similar lines, Evans founded the Negro Health Association of South Carolina to provide statewide education about basic health and sanitation. One of Evans' primary concerns as a doctor and a humanitarian was the welfare of children. She founded a clinic dedicated to treating infants and teaching their parents proper health care. Under the auspices AUSPICES of South Carolina Public Schools, she took it upon herself to examine the health of black school children. When she found disturbing results, many were afflicted with ringworm, tooth decay, scabies, and other treatable illnesses. Officials began a program to examine and treat students routinely. Evans also took a more personal role in children's well-being. She opened up a pond for swimming on her own property for poor boys, though she did not know how to swim. She taught herself to swim and then taught many others. Though Evans never married, she adopted 8 children and took in others. Her 8 adopted children were John B. Evans, Mattie O. Evans, Jesse Trotty Evans, Myrtle Evans Lee, Edward Evans Robinson, Gresham Evans, and Sidney Trotty Evans. Evans received numerous accolades. Active in professional societies, Evans served as president of the Palmetto State Medical Society and as vice president of the National Medical Society. Beginning in 1930, she also served as a trustee of Haynes College, formerly known as Haynes Institute, where Evans once taught. The National Council for Defense gave her a commission, and she was an appointed member of the Volunteer Medical Service Corps during World War I. Evans also honored those who helped her. In 1916, she published a biography of her mentor entitled Martha Schofield, Pioneer Negro Educator. That same year, Evans also contributed to several issues of the Negro Health Journal. Evans died on November 17, 1935, in her home in Columbia after a short illness. Citations are in the description.